by hearing a little bit about yourself as Dr. Matty Moore and also as Matty Moore, a father.
Yeah, look, well, I'm a general practitioner, originally trained back home in the States. Married a lovely Texas girl who had been in my ear about Australia for years. Came over in 2011, worked emergency, got back to general practice, and through that was really exposed and began to practice medicinal cannabis medicine. I am a father, and certainly in my time prescribing medicinal cannabis, have been prescribing for some children too, and it's been extremely exciting. My daughter is actually benefiting from medicinal cannabis as well, as autistic and high functioning. So, that gives me a little bit of perspective, I think, from both directions, as far as, a patient and a patient advocate and a father of a patient with some of those conditions that I'm treating, which gives me a real appreciation and perspective on that particular treatment. So, yeah, it's a pleasure to be here, buddy.
It's great to have you on here to chat with us because, like you said, you have experience with this both professionally and personally. And so I think we'll be able to give some other parents out there some really good insight into medicinal cannabis and if it's the right pathway for them or not in their family. Let's start off by just telling us what are some of the main conditions that you're seeing it being used in?
Yeah, the pediatric system is very sensitive, and it's developing. And so, I tend to be very cautious and methodical and slow in my administration and treatments for both, geriatric patients as well as pediatric patients, because those systems are very different as far as pharmacokinetics and, volumes of distribution and things like that. Those buzzwords that you love as a pharmacist.
Yeah.
It's really an exciting area to be treating, but we're very careful with it. I first would want to say that medicinal cannabis isn't for every patient. I address expectations, number one, in telling my lovely families that, look, it's just like any other medicine. It may not be beneficial. It may not work. We'll give it a trial, and this use is only after trialing first line therapies, and that's kind of one of those boxes that we have to tick in prescribing this type of medicine for that sensitive population. So it's not for everybody, but those that it helps, it can be life changing. And me as observer and also a healer, seeing that is amazing. And to go from complete distress and at the end of their tether as parents, and finding the best options for their child, to see the light come back on, to see that development come back is just is so rewarding, as you can imagine.
So what would be the main conditions that you are seeing it, even though, got to tread carefully? Are we looking at like epilepsy and what are some of the other ones?
Sorry, I got lost in my own little story there. Forgive me. Resistant epilepsy is one that we treat. There's a couple of different subcategories and also just generally resistant epilepsy, but you've got Dravet syndrome, you've got Lennox-Gastaut syndrome, which are two kind of subsets of resistant epilepsy. We treat autism spectrum disorder children, both low functioning, high functioning, in their behavioral type issues, that the tantruming that's involved with that, the anxiety that comes with that neuroatypical brain, ADHD, all the interweaving symptoms there that are hard to really differentiate as far as indications, but all have benefited in those children with medicinal cannabis. You've got, those mental health diagnoses like anxiety, PTSD, even in, unfortunately, young young teens who have already had traumatic experiences in their childhood benefit from medicinal cannabis. You've got Tourette's, you've got insomnia, ADD, ADHD, like I said. So those are really the main indications that we treat, most of which are with specialist approval. If we go through the TGA, SASB portal and the pathways that are online for GPs to prescribe, there's Authorized Prescriber and SASB pathway, but those we have to have the specialists on board with us, and that's a really lovely, another extra brain, obviously, a specialist to help us make those decisions. And if, sometimes it's difficult to find amenable pediatricians or, child psychiatrists to give us that support. So we can also access medicinal cannabis through compounding pharmacies.
You sort of touched on there saying it's good to have another brain in the mix. Those conditions that you are talking about are quite major, or some of those are definitely major conditions. I imagine often parents are going in to sit down with their GPs and often feeling like maybe they're not being heard, or they're sick, they're trying to get answers, they want solutions and they're not getting anywhere. Are you hearing of many people getting pushback from their GPs?
Oh yeah, there's a great variation in, comfort level, education, their own biases, the stickler of, there's just not enough evidence to make decisions with cannabis as a medicine. And you're going to find, although increasing really by the month, you're going to find a lot of uncomfortable physicians who just aren't educated, because we still don't have, the training within our curriculums in medical school. The endocannabinoid system isn't there; it's not taught. So that I expect that to change very quickly in the next, 2 to 5 years, since cannabis is not a dangerous medication anymore. It's not a dangerous plant, as handed down by the World Health Organization and many other countries now. So yeah, it's difficult sometimes to get that support because of that bias. I mean, we've had 80 to 90 years of prohibition where we've lost that time to really get that evidence base to make our evidence-based decisions on. So there's a lot of hesitancy, and I can understand. I can understand that, because as a physician myself, at first, diving off that cliff and using this, much maligned plant as a medicine, it takes a little bit of risk to your reputation. And there's a lot of guys and gals that aren't comfortable doing that.
That kind of brings me to this next part, where I've heard of this really beautiful story that you've spoken about with a young boy who had resistant epilepsy, and he was getting results, but there's a bit of a story there with some conflict, right, with his GP. Would you be able to talk us through that story?
Yeah, sure. Yeah, this young man has had an incredible results, but was really not meeting milestones. Was aphasic, not really talking, and was really way behind. And I think that their family had sourced some oil over in the States and in Canada that they had imported for, I believe, a year or two, and had wonderful results. But then, that supply with, what happened with the world over the last few years dried up. And so they came to me wanting, some help to try to find, that same ratio of oil that helped. And that ratio is the famous Charlotte's Web mixture of 1 in 20 cannabinoid oil for those resistant epilepsy cases, and a lot of data that supported it in Canada at University of Saskatchewan. So we restarted his oil, because he had really taken a huge step back again after not being able to use it. And this little guy had gone through every single first line therapy for epilepsy, and had a honeymoon period with each of those where it started to work. Hope was within their family, and then it just didn't work anymore. And so they were, really distressed, and reached out to their family back over in the States and got the oil and were using it, then weren't able to use it, took a step back. And so that's where I came in to reintroduce that through, approvals and through applications. And so they had great results. I mean, he's met all his milestones. He's functioning. He's back at school. He went from 150 seizures, one day previously, and then restarting his oil, he had none the next day, which is major and life-changing and huge, and yeah, super significant. And so that was one of the first real pediatric cases that I was involved with. And as a clinician, that's just eye-opening. When you are used to prescribing and co-prescribing those medicines along with the specialists, and they typically work. They'd gone through every single one. None of them worked. And then here comes, the much maligned cannabis, and it absolutely was life-changing. So, that was really, really the straw that broke the camel's back for me as far as being confident in my prescribing for children. And so, I'm certainly not cavalier, but I felt like that gave me a lot of confidence in order to prescribe for that particular indication. And then over the years, it's compounded even more with more and more indications that we're prescribing for, which is really great.
To kind of go back a little bit on what you said before with there's been such a long period of prohibition where we've not been able to collect any data and evidence. And this has been a perfect case for you to sort of see, this could really work. Maybe this is really something. Where are we at now with research and evidence and with moving forward? Are we gathering more? Are we finding more GPs are starting to get on board a little bit, or where's the research at?
Yeah, on a month-to-month basis, you're getting more and more GPs prescribing. You're getting more and more specialists, pediatric, subspecialties who are also doing so, pain specialists. So, the word's getting out, the positive results, word of mouth, more and more people that are getting positive results, that really matters. And so the way the TGA is doing things, I think is really by the book, and we got to commend them on doing that in a really organized fashion. So as far as the research that's going on, Australia is really doing a whole lot. And we've got cases all around the country in different research studies and indications that are being done currently. So we're starting to compile that over the last 5 years. Certainly, you've seen an exponential growth in research with cannabinoids.
Yeah, that's great to finally be moving forward. But it does take time, doesn't it, to collect evidence?
It does, absolutely.
And people want to see evidence-based treatment, and so that's good that we're moving forward. You had mentioned with Charlotte's Web about a ratio there, so I just wanted to see if we can talk a little bit about the THC component, because I know that might be a component that you hear a bit about of it being the one that might affect or cause drowsiness and XYZ. Can you explain a little bit about what THC is and how it is used in pediatric medications?
Yeah, no worries. Well, the cannabis plant is complex, and there's a lot of compounds within that are therapeutic. That's why we use it as a whole plant medicine. You hear about CBD and THC. Those are our majority cannabinoids. But there's many others. There's hundreds of minor cannabinoids. There's terpenes, which give it its flavor and its smell. Flavonoids, and they're all used. And terpenes, furthermore, are very much like catalysts that making small differences and tweaks in terpene profiles can help that cannabis work completely different. But in answer to your question, THC is the psychoactive part of the plant that we're most wary of and careful with because of that. And that THC, brings along with it most of the side effect profile for cannabis. CBD is really benign. You're not going to get a whole lot of side effects with CBD, and it's very well tolerated up to in very high doses. But THC, being psychoactive, causes sedation, causes euphoria and changes in behaviors, and although very positive, it can be, but also it flips into a negative side, and too much can cause psychosis and things like that. So we're super careful, certainly in our pediatric populations, because of that developing brain. We don't want to stunt growth. We don't want to cause any, toxicity. So, we're very careful in starting THC in our young ones. But THC has a real beneficial profile at certain doses. And one of those conditions that we treat with a little bit of THC, because of its help, is resistant epilepsy. And they found in those studies, although small studies, but they did multiple studies in Canada, US, at the University of Saskatchewan, that showed that the most beneficial ratio was 1:20. And what that means is there's 1 milligram of THC per milliliter in an oil and 20 milligrams of CBD per milliliter in that oil. So that was the most beneficial. That was titrated up slowly to effect. And, what was seen is, you've got your safe dose ranges of cannabidiol, which is CBD, and that's really around 1 milligram per kilogram a day. That's your low dose. Your medium range would be 1 to 10, and then your high dosage range would be 10 to 50 milligrams per kilogram a day. And THC is a little bit different. Those doses are much lower, and so we're very careful in increasing and titrating those up. It is used. It's nothing to be afraid of, but we're just careful and very methodical about using them. We don't use them in high doses, and we're certainly really careful.
I suppose it goes with any medications in pediatrics. We're always very careful with dosing, whether it's an antibiotic or a pain medication or medicinal cannabis. You had mentioned that with the dosing, you're careful around making sure it's not going to do anything that might, I think you said, stunt growth. Is there anything else that might be of concern, like could it affect their learning abilities or schooling or anything like that?
Well, we don't have the long-term data, to be honest, but what we've seen so far, that there isn't any long-term, cognitive decline. But quite honestly, we don't have those large patient sample sizes, double-blind, placebo-controlled, where they're done head-to-head with other medications, blinded. So to be honest, we don't really have that data. Mm-hmm. So we're super careful, to not exceed and really take it very slowly. And once a patient gets symptom relief, that's where we stop. We don't obviously exceed that for any reason, because, number one, you don't need to. And two, it can be expensive for families.
Why you said expensive, just remind me, there was one company that gives rebates for it. It was one insurance company. Is there still just one, or is there more now?
There's I think there's more now, and I think that competition for those insurers to get those rebates has dropped. That inavailability of them to get rebates. I think there are more and more insurance companies, but I believe it was UIC was one of the major ones. But what I would encourage your followers to do is check with their insurance companies and see, and if they get any pushback initially, talk to their boss or their manager, because quite honestly, sometimes they push back on rebates when actually they can give them. So I'm happy to send your followers to a website that has those insurance companies with rebates. We can talk about that later. I can give you a link.
Yeah, that would be fantastic. Definitely. There's
a website called Honolly.com here in Australia, which is a medicinal cannabis educational website. And one of their pages that they have are a list of those companies that do give rebates. So I'm happy to give that to you.
then we'll definitely add that into the show notes so that people can suss that out, because obviously finance and is a big one.
Yeah, you can't skate around that issue. It's super expensive, and you got to be cognizant of that for sure.
It's only natural to be apprehensive when you start any kind of medication, any new treatment or anything like that, especially if you're doing it with when your children are starting new medications. Is there anything important that parents should be aware of or prepared with prior to their child starting the medication? For like, is it better to do it over a weekend or in school holidays, or is there just anything that would better prepare them?
Yeah, look, I get a lot of questions as far as do I need to stop the medications that we're currently on? We don't typically, during that titration or that increase slowly of the amount of medication and frequency, we don't typically withdraw the other first line therapies. And I don't encourage them actually too, if they're somewhat stable on them, without, being, number one, being very careful with some management from myself or their specialist. But the medicines can be very scary for patients. So addressing those expectations, how long that it might take, that it may not be helpful. But advice on titration is really just to start extremely low. I typically give my patients a titration schedule, meaning it's a kind of a visual representation of over a 3-week period, whether they do it morning, afternoon, and evening, the actual amounts of doses and how frequently they need to do that for those particular indications.
So it can be more of a gradual process. It's not like doing some massive change straight up.
No, very, very, very gentle changes.
If a parent is fearful of chatting with their GP, or they're worried about there being any conflict, what advice do you have for them if they want to approach this pathway with their GP? Do you work collaboratively with other people, or?
Yeah, absolutely. And I'm always happy to correspond with anybody about this. And, keeping a good open line of communication is always number one, being honest. There's nothing to be afraid of about bringing cannabis up as a medicine with their GP or their specialist, because it is actually a medicine that they can access now. So, and the only way that we're going to break stigma and really combat the biases that have come along with cannabis over the last 90 years is actually having a dialogue about it. Being open, educating yourself enough. And if your GP or specialist isn't aware of those types of things, having an open dialogue, talking about it, and, flicking them websites that you've read or papers, and asking me to get in touch with them, I suppose, because I'm happy to do that.
And so if someone is keen to get started in the process with you, how do they go about that?
Yeah, look, we always encourage them to ask for a referral. That way that I have, an open line of communication with their general practitioner or specialist, so that, things are open. We don't want to, we don't want them to feel like, we're going behind their backs at all. But if they can't get someone to get them a referral, that's not a game changer, because what we do at our first consultation is really take the time, spend the time to, hear about their history, tweak out what medications that they've tried, if there's been any issues, previous psychosis, things like that, contraindications. And we can basically get all that we need out of that initial interview. And if we can't, we'll touch base with their teams. So basically they can contact me through my website. They can find me on Instagram at Dr Matty Moore. My clinic is Mode Healthcare. And, I've got a website, mattmooremd.com. And then my clinic website is modehealthcare.com.au. And
I'll pop all the links, so it's hard for parents, especially if you're sleep deprived, to remember all that information.
And listening to my accent, people may not get it.
And also, you're available to do a virtual consult as well, correct?
Yeah, absolutely. I mean, we always encourage face to face. That's great, but it's not not a game changer. We do video link chats. We do telehealth. And most patients are really comfortable because at the end of our conversation, they have my web address. They have my email to correspond with me for any questions or guidance. In the meantime, we like to keep that dialogue open because I know they're going to have lots of questions.
Yeah. Oh, thank you so much for taking the time to chat with me today. And that gives us a pretty good overview of medicinal cannabis in pediatrics. So I hope that we will have a few follow-up podcasts where we can take a deep dive into some of those other conditions and maybe look at a few case studies or a bit more condition-specific information.
Love to, Alex, and love what you're doing with Botica, and I know your followers are really getting a lot of good information from you. So I'm really happy to come back as often as you need to.
Awesome. Thank you so much.
No worries.